Okay, so where I left off yesterday, all of yesterday was basically just the bovine. But now we're going to talk about camelids, which llamas and alpacas are getting more and more popular. So if you work in large animal, there's a good chance that you might run into them. They aren't technically a ruminant, although their first stomach is similar, but they're kind of put into the ruminant category. One thing is they do have a lot of saliva, so we have the same precautions that we do in a cow. So when we're intubating them, we have to be very cautious. Atropine may or may not be used because atropine may make the secretions too thick. It can also affect GI motility. So that would be a doctor decision unless it was an emergency. Due to their saliva and their anatomy, they are prone to nasal congestion, and they are similar to a horse where they are obligate nasal breathers. So we always have to make sure that their nasal cavities are clear, make sure they're not up against a stall, make sure there's not too much mucus, always watch their respiratory effort because they have to be able to breathe through their nose. Now, I've probably not made this clear in other lectures. When an animal is breathing on their own, they typically breathe through their nasal cavity into the trachea. When they are intubated, then they are breathing through that tube. So once an animal is intubated, they are not dependent on their nasal cavity for breathing. But when we pull the endotracheal tube, they're going to start to breathe through their nose again. So that's when we have to make sure that it is clear. As far as preparation, history, physical exam, blood work, why are they here, what procedure are we doing? You can do in-hospital or field anesthesia, and the same principles apply. If it's going to be a long invasive procedure, you need to be in the hospital with oxygen support. They do have pretty thick skin, so sometimes catheter placement is a little more difficult. They have a very long neck, so endotracheal tube placement is not a challenge, but you have to be cautious with hematomas. Any swelling in the neck could push on the trachea if it was big enough, so we have to be cautious. As far as maintenance, it is the same as for a small ruminant, so you're going to probably need the stylet, advance over the endotracheal tube. The other thing is that what's interesting is they can be aggressive, and I think you guys are going to the farm, or maybe I heard you guys already dealt with llamas, and you see the spitting, and they kind of watch you. You don't really want to make eye contact, so they may need more sedatives than, say, a cow would, just beef. They're unpredictable. The thing is their size, they're thinner, so you would also just bag them periodically. You wouldn't necessarily need to maybe put them on a ventilator. You're always going to check the CO2, check their ventilation rate. You may want to put them on a ventilator if needed. There is a note that their heart rate can be more variable. Ruminants tend to be pretty slow, pretty even keel. These guys can be a little up and down. Again, that'll be up to your doctor whether you treat with atropine or glycopyrrolate. Again, most of the time, when I worked at the anesthesiologist, we didn't use atropine routinely as a pre-med. But if they develop bradycardia, then we could go ahead and treat it during surgery, and you would want to do that. When they do go under anesthesia, be careful because of their neck. We want to make sure someone's restraining the head, and we don't want to have it twisted in an awkward position. And also they have very prominent eyes, similar to a horse. So again, we talked about a horse. You want to make sure that we don't get corneal scrapes when they're laying on the ground. When they're going down, you want to make sure their eye isn't next to a wall. And also we want to make sure their head is low, like a cow, so that because of all this saliva, we want it to drain out or any regurgitation. So the interesting thing I hope you're hearing is they have characteristics of horses and they have characteristics of cows. So the technique is a little bit of both, is similar. But again, with that saliva, anytime you lift up the head, any regurgitated fluid because of their rumen-like cavity and any saliva can cause aspiration. When they do recover, we typically want to put them in sternal. You may need something like a bale of hay or some pads to, support the neck. Again, you can be in there with them. But again, if they're aggressive, use it with caution, but they are more restrainable than an adult cow or an adult horse. But when you are waking them up, you can see in the next picture, they've got somebody that's holding the head. So at this point, you do want to keep the head upright. When they're first asleep, you keep the head down. We wake them up, we put the head up. Now, as always, if they're in recovery, if labored breathing or stridor is a loud inspiratory breath, that's what stridor is. So if you're hearing loud respiratory sounds, if you're seeing labored breathing, abdominal breathing, you can come in and put a face mask of oxygen on them. If they're having a really hard time, you can put in nasal tubes. Now, you're only going to put in nasal tubes if they don't have an endotracheal tube. So this would be, you pull the endotracheal tube, they're having difficulty, then you can go ahead and do that nasopharyngeal tube. And this is going to, again, if they're having trouble breathing through their nose, you want to be cautious. So you want to check for stridor, you want to check for respiratory difficulty, and then you could put in those nasal tubes. In this picture, they're supporting the head, the endotracheal tube still in, so you're going to look for very vigorous swallowing, chewing, purposeful movements. They can wake up. They're not quite as flighty as a horse. They're probably in between a cow and a horse, so they could need sedation. They could need restraint on recovery. So that is a possibility. In this picture, you can see they've got bilateral nasal endotracheal tubes in. So you can put two in if, this would maybe be if one nostril is impacted or if they're having a really difficult time. And again, the nice thing with nasopharyngeal intubation is that this guy can be chewing and licking and you can still provide oxygen support. Now, think about this. If you have one that's having a hard time breathing, if you put a face mask on there and there is nasal congestion, the mask is not going to help if the nasal passages are congested. So you may need to do this. A mask would be, they need some oxygen support, but their nasal passages are clear. So you would want to confirm that before you pick one or the other. Okay. So we're going to talk about swine. And when I talk about swine, there's two aspects to working with swine. Obviously, when we think of pigs, they are a food animal, and you have large farms, and they are produced mainly for their pork. Very rarely are we going to do procedures because, again, they're a food animal, and it's income. So it's going to be rare that you're maybe going to do extensive surgeries on a farm pig. But there's two other situations. Pigs are often used in research. Pigs actually model very close to human physiology. So pigs can actually be used a lot in research. So if you go to work for I'm trying to think of the name, Covance or some type of lab, you might actually work with swine. Elanco, which is a division of Eli Lilly, has a very large farm animal research facility where they work with drugs for large animal. And so I have several friends, and I know of some previous students that have gone to work for Elanco, that have gone to work for Covance, and you might work with swine. The other aspect is if you do exotics, people that own potbelly pigs, and they would qualify under swine anesthesia. So some people do keep them as pets, and I've actually seen two come into emergency clinics that I have worked at. I guess it's very rare, but they are gaining popularity as a pet, live in the house, and do everything. But so when I talk about swine anesthesia, I'm going to talk about some generalities. And that applies to farm pigs and research pigs, and that applies to potbelly pigs. So there's some general principles with the swine. One is that they're very challenging to restrain. I mean, they just start, the minute you try to hold them, they start screaming and they want to flee. So it's very challenging to sedate them and to anesthetize them. Also, to do a physical exam. When I get into exotics, which is we're doing next, sometimes the stress level on exotics, you do some of your physical exam just observing them, watching their breathing. If you need a respiratory rate, you do not need to put a stethoscope on them. You can watch them and you can get a respiratory rate from afar. So anytime you have a stressed patient, like a swine, I'm going to probably observe them in their pen or their stall or wherever, and I'm going to try to look at their coat, look at their eye condition, look at their behavior, look at how they're walking, observe their general overall condition. So try to do as much as you can before you actually hold them, because trust me, once you get a hold of them, you're going to have to start doing stuff like this. You're going to have everything ready because, first of all, you're going to be deaf because they're going to be screaming in your ear. And so a lot of times I will tell you, we will sedate a pig and then we will put the catheter in and do blood work and get a heart rate. I mean, obviously I want a heart rate before I anesthetize a patient, but if they're going to be that difficult and screaming and I'm not going to be able to hear the heart, sometimes we have to do some of that stuff after they're sedated. No different than if I had an aggressive dog for anesthesia, if I have a German Shepherd and they're trying to bite my face off, we're going to probably get blood after they're asleep, or we're going to get blood, after we have some sedation. And they're also extremely difficult to sedate. To intubate. So I'm going to talk about that. So again, this is what I want you to do. Look at them from afar. You can assess respiratory rate and character without a stethoscope. You are just going to look. And it's no different, say you guys have a dog in the kennel for radiology and they're acting a little strange, or you have a cat that's growling. You can look at the cat and get a respiratory rate without actually putting a stethoscope on the patient. Again, you're always eventually going to listen to them, but initially we can get some information from observation. You're going to have to rely a lot on the owner history. What have they observed at home? What is their behavior? How are they eating? Are they finishing their food? Does their coat look different? Are their eyes glossed over, goopy? Do they look unkept? I mean, it is a swine, but sometimes you can tell their hair coat is just off and their eyes are goopy, or they're not shiny, they're dull. Nasal discharge, are they coughing? Things like that. So again, a lot of your cardiovascular status and blood draws are going to happen after sedation. So you're going to have to make some assessments for a protocol based on just observation. Okay. And again, we do that from time to time. We don't have a lot of a choice. Most of our sedatives in these guys is going to be almost impossible. Think about their skin. If you've ever eaten an Easter ham, and some ham comes with the skin on it, it's extremely thick, and they have a very thick layer of fat, and their muscle is very dense. So you're not going to hit a cephalic vein in these guys, potentially a lateral saphenous, but we use the ear vein a lot. But if we're going to give an injection, you're going to want to use the neck muscles, okay? Think about, and you should have covered this in large animal, but think about the lateral neck like a triangle. So if I go from the caudal ear to the shoulder and about 3 to 5 centimeters towards midline, there's a thick band of muscle. And you're going to need a big needle. Don't use a little 22 gauge, 3/4 inch, because then you're just injecting it into the fat. So you're probably going to need at least a 1.5-inch needle, and you're going to use the muscles of the neck. Why do I use the neck? Because nobody wants an injection or scar tissue in their Easter ham. The back muscles, the gluteal muscles, are all prime cuts of pork, and we don't want to give injections. Now, if this is a potbelly pig or potentially a research pig, that might be different. But if I'm talking about a food animal and they're on a farm, we don't want to use the rump muscles. We don't want to use the back muscles because we don't want to damage the meat. We could get an abscess, and then that forms scar tissue, and then the farmer can't get as much for their meat. So we have to be careful. You're going to have to be able to know to tell me that you use the neck muscles. They're also pretty stubborn as far as how fast do they go to sleep. So they're a little more resistant. We tend to use higher doses. Usually a tranquilizer, we're talking like acepromazine, xylazine. You're going to use a lot of xylazine. Usually mix it with some type of an opioid. They don't have sensitivity, so you could use morphine, hydrobutorphanol, and then a lot of times we use ketamine in this protocol. Okay, so let me get into one of the very, very common protocols. I've mentioned this for other species, but when we work with swine, some of the sedation is enough for what we need to do. So you can do light sedation for like a laceration, an exam, a blood draw. If we need to do something a little more in-depth, a common protocol we use is called TKX, tilazol, ketamine, xylazine. Now, normally when I've talked about other species, you don't usually use two drugs from the same category. Well, tilazol and ketamine are both dissociatives. They come from the same family. But in this case, it is a very common protocol that produces a very deep sedation, and in some doses, a surgical level of anesthesia. So if I ask you what TKX is, tilazol, ketamine, and xylazine, you combine it in the same syringe, give it in the neck, and somewhere between 5 and 20 minutes, they will typically fall asleep and be sedated enough for the procedure. So when you use, and again, depending on the dose that you use is going to depend on the level of sedation or anesthesia. If you give it low doses, it'd be for sedation. If you give it in higher doses, it would be for anesthesia. Okay, one thing when we're monitoring pigs is normally the eyes are usually one of my favorite things to look at that help me tell how deep or light they are. In pigs, they tend to not move as much as they do in other species. So you're really going to have to look at heart rate and respiration. The other thing is the mouth is going to be better. Now, their mouth doesn't open very wide, but when they are adequately deep, it does get fairly loose. So you're probably better at looking for the relaxation level of the mouth than you would be looking at the eyes or checking for a blink. If you need to give more, say you start doing the procedure and they are getting light, you can put a catheter in the ear vein. So that is the preferred location, and it's going to be similar in a rabbit. So they do have a vein that runs around the edge that you can see. We would put a catheter in it, we put a roll of gauze under the ear, and that supports it. Since it's a flat structure, you want to make sure you don't go through the ear, but you go very superficial, and then you can tape it in. Now, that's not a catheter. That catheter may not stay very well like after surgery, like we would leave it in a dog, but it could be just a catheter to give more drugs or run fluids during anesthesia if need be. So it is an option. If you also are just doing TKX and they're waking up, you can put a mask and give them some isoflurane or sevoflurane to keep them anesthetized. So that is an option too. Now, I will say you really don't want, you're not going to be able to mask them down, like to anesthetize them, because they're just too wiggly, strong, screaming, you're definitely going to want to give them an injectable and then use inhalant to top them off or to keep them asleep. Now here's a picture of a pig. You can see kind of some blood. This is the lateral aspect of the neck. So here's caudal to the ear. You think about a triangle. That's the lateral neck muscles that you want to use for injection. You can see they're lateral recumbent, they're anesthetized. You can do what you need to do. Okay, in this picture, you can see that here is the ear. You can clip, sometimes you don't have to clip, but you would clip it and prep it like you would for an IV catheter. They are using a rubber band to act as a tourniquet. You can have someone try to hold it off. And you can see in this picture, they've put a roll of gauze under there and they've put tape around it to secure it. So you can possibly leave that in. Oh, and always make sure you remove the rubber band after you put the catheter in. So the rubber band does not stay. Here is a mask. Here's a couple different pictures. The one on the left, this is obviously looks like a food producing pig. They've got a traditional mask with a breathing system. And then this pig looks like a potbelly pig, and they've just made a homemade mask out of a jug. So sometimes you have to get creative. But again, these pigs have probably been given sedative first, or TKX, and then they're going to mask them to give them additional anesthetic. So now what makes it difficult for swine, small mouth, their teeth are narrow, and when you get to the very ventral aspect of the larynx, they have a diverticulum, and a diverticulum is like it divvies off, or it's like a shoots off to the side, like a little pocket. So you don't want to get the tube in and then slip into that pocket. So the trachea is also very proximal. Like once you go over the tongue and you see the larynx, the trachea is right there. They are also prone to laryngospasm. So in bovine and in swine, you're going to use lidocaine spray. I told you in cats, you drip lidocaine in, and these guys you're going to want to use a spray, which is going to work a lot better. So you want to keep them in sternal, but you can also do them upside down. Like in people, intubation is usually done upside down because we have a natural curve to our trachea, so they're a little bit like people. So you could put them on their back or sternal. You don't want to have them in lateral. And you need to have a stylet and a laryngoscope. And even better is if you have a curved stylet. But most of the time, the stylets we have are straight. So you can see someone's using a leash to hold open. You use the laryngoscope and you're going to put the stylet in. Make sure it's not a sharp stylet. You're going to put the stylet through the larynx first, and then you're going to slide the endotracheal tube. So this is very similar to a calf. But if you can see, that mouth isn't open very wide. So you're not going to get them nice and wide open. So that's what makes them a little difficult. Most of the pigs are going to use a small animal machine. Most of these guys are going to be under 300 pounds. But again, if you get those really big ones, you would have to have access to a large animal machine. But a rebreathing system, an adult rebreathing system with a small animal machine, you can use. So some places to get some monitoring. They do have an ear artery. They also have an artery here on the carpus. If it's a little pig, the brachial artery is near the armpit. So like in babies, sometimes you can feel here on the little infant, and on the inside, this is the brachium. So the brachial artery is on the medial aspect. So if you feel inside, not the armpit, but if you feel on the limb, you can sometimes feel it there, or you can put a Doppler over the artery in the tail. So we've got some options. If we're going to do a pulse oximeter, you can do it in their snout, like right here. You can do it on the ear. If they're pink, you can, now their tongue, you can try the tongue, but the problem is their tongue is very thick. So sometimes it doesn't read well on the tongue, but you definitely want to do that. Have some type of respiratory monitor like a capnograph. You can watch the breathing bag, actually watch their chest move. So all of kind of the standard monitoring, you just have to get kind of creative. Here they have a Doppler. So what they did is they put that on the metacarpal artery. Remember, the light with the crystal bounces off the artery, and then that will elicit a pulse sound that you can listen during surgery. You can put a cuff on their limb. Again, they have very short, muscly, thick legs. So the cuff may or may not give you good readings, but you can definitely try. And here's an example of a pulse ox on the tongue, or it's placed here on the snout. Now, let me mention this other tube here. This is a temperature probe. So a lot of monitors come with a probe and you can slide it in. Now we usually put it down the esophagus, but you could put it in the nasal cavity. You can also put them in the rectum, and it'll give you a continuous temperature throughout the procedure. So that's just kind of what you're looking at. Now, there are some concerns with pigs, and there's one thing called porcine stress syndrome, but I've talked to you about malignant hyperthermia. Most of the time, I'm very concerned about animals getting cold. Very rarely do I worry about hyperthermia, but humans and pigs are prone to malignant hyperthermia. It's a genetic mutation in their muscle, and a lot of times it is brought out by anesthetic. Now, unless you do a muscle biopsy before surgery, you would not be able to talk about this condition. What they used to do in pigs to screen a litter, they would take one pig from the litter and they would anesthetize it. And if it developed hyperthermia, you knew all of the pigs in that litter carried that mutation, okay? So how do we know that they're becoming hyperthermic? The muscles can get rigid. So even though they're anesthetized, they feel kind of rigid. Temperature is going up. Like I said, most of the time in anesthesia, your temperature goes down. It's very rare that a temperature would increase during anesthesia. Elevated CO2 is hypercapnia. So that would be, AJ, hang on, shoot, sorry. He's going through his evening crazy period. Okay, so rise in temperature, rise in CO2. Hyperkalemia is an elevated potassium. So if you're monitoring potassium, we would see this. AJ, stop. Sorry. And eventually it would lead to death. Now, sometimes death is unavoidable. Sometimes by the time, because if their CO2 is going up, if they're rigid, are they waking up? Sometimes these signs can be interpreted as other things, but a high CO2, also, I should put on here injected mucous membranes. They tend to get a very brick red color, not that nice pink and not pale. They're going to be very, very red, very fast CRT, like a quarter of a second. And then, again, the way to treat it is you need to stop anesthesia as soon as possible. Give them inhalant, reverse any drugs you can. There is a drug that treats it called dantrolene. If you have a clinic that works with pigs and does a lot of anesthesia or like research, they may carry dantrolene. It's a human drug. Not all places have it, but that will treat it if you have access. Okay. So recovery, it's going to be about the same as, we're going to wait for them to move, twitch, wait for them to swallow 2 or 3 times. Once you pull the tube, make sure they can breathe, make sure they're breathing normal. If they're going to be hospitalized, again, you can leave that ear catheter in. The problem is trying to wrestle them down to take the catheter out. So if you leave it in, a lot of times in these guys, well, let me give you an example. When you guys are in surgery rotation, you don't normally pull the catheter till they reach 99 degrees and they're fairly awake. But if you had like an aggressive cat or an aggressive dog, a lot of times we'll pull the catheter before we even extubate them, because you don't want to wrestle them down to try and pull a catheter in an aggressive patient. So there have been times I pull catheters, because you usually like a catheter during recovery if you have an emergency. It's nice to have IV access, even if you're not running fluids. It's nice to have a catheter to give emergency drugs, reversal agents, IV fluids. But if the pig is going to be crazy and unruly, you're probably going to want to pull that catheter unless you need it for fluids or hospitalization. Okay, so that goes through this lecture. So watch the 2 videos. And again, we will on Friday, we'll go through the homework review. And then on Monday, there will be a quiz. We're not going to meet on Monday for a review. So Monday, I will open the quiz at 2:25, since I'm not going to have a Zoom review unless you need it. And if you have questions, I always I'm available in the afternoons to set up a Zoom or to set up a chat if you're not understanding something. Okay? Have a good evening.